Hello listeners, welcome to Radio Zindagi 1550 AM and 99.7 FM HD3। मैं हूं आपके साथ में आरजे ईरा, लेके आए हैं आपके लिए हेल्थ की बात डॉक्टर सी के साथ। डॉक्टर सी, वेलकम टू द शो।
Thank you very much, Ira. Namaskar, Shrotaon. Thank you for tuning in. And once again, आज middle of the week, middle of the day, बुधवार के 12 बजे हैं और हम आपके पास आ गए हैं और आपके साथ हम दो एक्सपर्ट्स लेकर आए हैं। जैसे आई हैड प्रॉमिस्ड यू, पिछली बार मैंने आपको बोला था कि हमारे पास आज जॉइंट्स ही जॉइंट्स हो जाएंगे। वी हैव टू एक्सपर्ट्स व्हिच यू हैव हर्ड
Today we have a joint family. One big joint family.
Yeah. Ira, you're funny.
Yes, thank you.
आज तो मैं सिर्फ विशेषज्ञ हूँ जोड़ों के बारे में देखने का, लेकिन मैं सिर्फ देख के बता सकता हूँ इन डॉक्टरों को कि जोड़ ऐसे लग रहे हैं या एमआरआई में ये आ रहा है या न्यूक्लियर मेडिसिन के बोन स्कैन में ऐसा आ रहा है या ऐसा प्रतीत हो रहा है कि हड्डियां थोड़ी घिसती जा रही हैं, बढ़ती जा रही हैं, टेढ़ी होती जा रही हैं, इत्यादि इत्यादि। किंतु ये हैं जो असली काम करते हैं उसके बाद, जिनके समक्ष आप पहले जाते हैं, उनके साथ इन चिकित्सा प्राप्त करने के लिए उनके पास जाते हैं। तो ये दो आपके डॉक्टर्स हैं, चिकित्सक हैं आपके, एंड शल्य चिकित्सक यानी कि सर्जन्स भी हैं साथ साथ। तो एवरी सर्जन कैन ऑल्सो गिव मेडिसिन एंड मेडिकेशंस एज वेल एज दे कैन गिव यू एडवाइस व्हिच इज कंप्लीटली medicine free as well. So they can give you physiotherapy actions, modifications, behavior modifications, all those kind of things, and they can give you prescribed medications. But if it's not solved by these kind of traditional methods, then they can actually perform surgeries. Surgeries can be of two types. They can be invasive or minimally invasive. Invasive का मतलब जितना चीर फाड़ शल्य चिकित्सा कम ज्यादा की जाती है, जिसमें इंसिशन यानी कि जो कट है जिसके थ्रू ये अंदर जाते हैं, वो अगर सामान्य है जैसे पहले होता था, ट्रेडिशनल है 2 इंच 4 इंच 6 इंच या कई बार ज्यादा, तो उसको कहते हैं सर्जरी। लेकिन जब इस बड़े वाले स्कार को कम कर दिया जाए या अप्रोच उसकी लैप्रोस्कोपिक हो जाए या यंत्रों के द्वारा, नलियों के द्वारा अंदर जाके ही की जाती है, जिसमें बाहर सर्जन टेलीस्कोप से देख रहा होता है या किसी वीडियो मॉनिटर पे देख रहा होता है, और ये यंत्र अंदर जाके शल्य चिकित्सा कर रहे होते हैं इनके लिए, जो कि कई बार रोबोटिकली असिस्टेड भी होने लग गया आजकल। तो उसको कहते हैं मिनिमली इन्वेसिव, यानी कि चांसेस ऑफ यू गोइंग बैक होम आर वेरी हाई द सेम डे। ऐसे आधुनिक कैसे परिवर्तन आ गए हैं आज की शल्य चिकित्सा में, इनका भी हम वार्तालाप में हम शामिल करेंगे ऐसी चीजों को। एंड वंस अगेन वी हैव two of our doctors. One is a spine surgeon, orthopedic spine surgeon, one is orthopedic joint surgeon. The spine surgeon is Dr. Sandeep Gidvani, and welcome to the show out here, Dr. Gidvani.
Thank you, Dr. C. Great to be back.
And and we welcome you back. And we also have Dr. Daljit Sagu, dono ke dono, and he is a joint specialist, orthopedic joint specialist. Welcome to the show, Dr. Sagu.
No, thank you for having us. It's a pleasure to be here.
Yeah, so now since we are now all introduced to our joint family, श्रोता मैं आपसे अनुग्रह करूंगा, आपसे निवेदन करूंगा और आपको संकेत दूंगा कि आप अपने फोन उठाएं और 510 770 1550 पे जितने फोन करना चाहें अपनी सारी समस्याओं को लेके उसका हम विश्लेषण करेंगे। We'll discuss your problems and these doctors will pick up your calls based on their specialty. अगर आपको रीढ़ की हड्डी यानी कि स्पाइन में कोई तकलीफ है तो उसके बारे में बात करें, और if you have any issue with your joints, knee joints, especially hip joints, hands, if you have carpal tunnel issues, अगर आप below 50 age group में, above, if you are in the senior age group, whatever it is, you come up with your problems. There are different broad categories. I will ask these doctors, our specialists out here on the studio, to tell us about the different problems in different age groups, the different types of treatments they offer, and what can be done non-surgically. क्योंकि कई बार हम लोग सर्जरी से डरते हैं या उसे थोड़ा लास्ट रिजॉर्ट की तरफ रख देते हैं। तो ऐसे कौन से डिफरेंट ऑप्शंस हैं, आप अपनी रियल लाइफ की सिचुएशन हमें बताइए, phone kariye, and Ira will handle all of these calls one by one. She will direct them. Spine will go to Dr. Gidvani. Joints will go to Dr. Sagu. Please call us. Meanwhile, I will ask Dr. Gidvani and then followed by Dr. Sagu. Please tell us what are the most common problems you see in your specialty, in what age group, and what are these treatments? Please give us a refresher.
So in terms of spine problems, oftentimes patients will come to us from various age groups with either neck pain or back pain. And typically speaking, the most common problems we see within both of those are arthritis or degenerative disc disease, where the pain is isolated to their back or to their neck. Oftentimes the pain can also go down either their arms or their legs, and in those cases we see other common problems such as disc herniations, spinal stenosis or narrowing of the spinal canal, or even in both the neck and the back we can sometimes see what's called a slip disc, which like we discussed previously is not necessarily mean that there's a disc herniation, but rather that there's an instability where one bone has slipped forward over another.
That's very nice. इसको मैं जरा सा हिंदी में इसका परिवर्तन करके मैं आपको बताता हूँ. ये बताना चाहते हैं डॉक्टर गिदवानी की 3 किस्म की जगह होते हैं. एक स्पाइन में ज्यादातर या तो आपके गर्दन की तरफ की स्पाइन में तकलीफ होती है, या थोरैक्स यानी कि छाती के पीछे वाले पिछले बैक जो बोलते हैं उसे थोरैसिक स्पाइन, वहां तकलीफ हो सकती है, या फिर लंबार स्पाइन विच इज द लोअर स्पाइन, वहां तकलीफ होती है. ब्रॉडली स्पीकिंग यहाँ होती है. सबसे ज्यादा जो लोगों की नींद में बाधा देता है वो है गर्दन की तरफ का पेन, क्योंकि जब आप लेटते हैं, आप करवट लेते हैं, कुछ करते हैं, तो आपको नींद नहीं आती, दर्द आपको उठाता रहता है. बैक पेन सबसे ज्यादा लोगों को तकलीफ देता है. जब लोग काम करते हैं, उन्हें झुकना होता है, उठना होता है, कभी किसी न किसी वक्त अगर आपको बैक पेन कभी भी हुआ हो, भले ही एक दिन के लिए या चंद घंटों के लिए या उससे ज्यादा के लिए, तो आपको पता होगा कि मैं किसके बारे में बात कर रहा हूँ. इट इज सो डेबिलिटेटिंग एंड सो लिमिटिंग कि आप अपने काम को नहीं कर पाते हैं. उससे प्रोडक्टिविटी लॉस होती है, इकोनॉमिक लॉस होता है, छुट्टियां लेनी होती है, कई और तकलीफ होती है. उसका ये बता रहे हैं कि जैसे कि या तो नैरोइंग हो जाती है, यानी कि अंदर रीढ़ की हड्डी के अंदर एक कैनाल होती है, वो स्पाइनल कैनाल, उस तरफ या तो स्टेनोसिस में कंप्रेशन होता है, या फिर 2 हड्डियां जैसे रेलगाड़ी के डब्बे होते हैं, उनके बीच की जो डिस्क होती है, जो शॉक एब्जॉर्बर होती है, जो हमें मुड़ने की पॉसिबिलिटी देती है कि हम स्पाइन को मोड़ सकें, आगे पीछे जा सकें, जिम्नास्टिक्स कर सकें, योगा कर सकें, झुक के चीजें उठा सकते हैं. वो जो 2 रेलगाड़ी के डब्बे वो आपस में बड़े अच्छे से अलाइंड होते हैं, लेकिन कभी कभी ऐसा होता है कि वो बीच की डिस्क या तो घिस जाती है, या उस पर जोर पड़ता है, या चोट पड़ती है, और वो स्लिप हो जाती है. एंड देन दीज टू कैन गो आउट ऑफ अलाइनमेंट, एंड दैट इज अगेन ए प्रॉब्लम विच कॉजेज बैक पेन. And it can happen in any part of your spine, but usually happens more in the weight-bearing portion of the spine, which is your lumbar spine, which is यानी कि नीचे वाली back, कूलों के ऊपर. And उसके समस्या का समाधान भी हम अभी इनसे पूछेंगे कि क्या क्या किया जा सकता है. And then finally जो अभी हमने बात नहीं की है वो है, वहाँ थोड़े कम लोगों को ज्यादातर ट्रॉमा जो एकदम सीधा पेल्विस की तरफ आ जाते हैं, SI joint, which is sacroiliac joint, उस तरफ भी तकलीफ होती है. Or so Dr. Gidvani, tell us what are the different treatment possibilities for these 3 different sections, and what age groups does it affect more than the other?
Sure. So certainly the older you get, the more vulnerable you are to developing spine problems, because as you mentioned, or the comparison you made, that between different train cars, the connection between them is the disc. So as you get older and your spine bears more and more weight, or through different activities such as contact sports, football or soccer, or anything that the body is taking on loads, those loads are transmitted through the spine. So the central portion of the spine, or the central portion of the disc, which is the jelly, can start to lose its substance and its hierarchy, and therefore you can get the onset of these type of pains that we discussed. In terms of treatments that are available, basically, we always start with the conservative modalities, including therapy to try to help the muscles around the spine get stronger. Sometimes we can use injections to help calm down the inflammation that often is responsible for symptoms going down the arms or the legs. And then we get into surgical treatments, which mainly revolve around decompressions and potentially stabilizing unstable situations such as fusions.
Okay. तो यानी कि अलग अलग किस्म के चिकित्साएं अवेलेबल हैं. ऐसा करते हैं कि हम लेट्स टेक सम रियल कॉल्स एंड अंडरस्टैंड सम रियल इशू प्रॉब्लम्स सो यू कैन solve them in front of us, and then in the next half hour we'll go towards the knee joints and the hip joints and the other joints, not the spine. So in the first half hour we will take पहले आधे घंटे हम स्पाइन के बारे में ज्यादा बात करेंगे. उसके बाद हम जोड़ों के बारे में, बाकी के जोड़ों के बारे में बात करेंगे. तो आप इरा जरा देखें कौन कॉलर है हमारे, और इज इट रेलेवेंट टू स्पाइन? अदरवाइज वी कैन ऑलवेज हैव डॉक्टर सागू आल्सो आंसर.
Yes, we do have 2 callers. Let's take the first call. Hello, you're on air.
जी.
So, मैडम, आप ये पीछे रेडियो जो बज रहा है उसे प्लीज पहले बंद कर देंगे, बहुत डिस्टर्बेंस होती है.
ओके.
हाँ जी.
कॉलर है हमारे, और रेडियो बंद करके अपना नेम और लोकेशन बताएं प्लीज.
बिल्कुल. Yes, ma'am. So, your name, your location, and what's your question?
Okay, my name is Madhu and the location is Pleasanton, and I have a question from Dr. Saggu about knee surgery. Like, what's the best? के बिना दर्द नहीं हो knee surgery के बाद?
Well, that's a very good question. It's a question I get all the time in the clinic. So it depends on what's wrong with the knee. If you're young enough and you still have your joint preserved, meaning that your cartilage is still preserved, you would benefit from a knee scope. Basically, it's putting in a camera into the knee joint, and you basically clean out the knee. You also get a clear look at the cartilage. But basically, that type of procedure, it's a same-day surgery procedure. It's a joint preserving procedure. And then basically, based on the pathology, you can say that, does the patient have, you take a look at the quality of the cartilage. However, when someone has a lot of arthritis, which I, commonly get, in the 60 to 90 age group, you're pretty much looking at, of course, you want to do what Dr. Gidvani, says, we want to do the non-surgical modalities like physical therapy, injections. You can do stuff like yoga, which my mother-in-law, stresses a lot. However, if you fail the conservative management, you can then opt for a total knee replacement or even a partial knee replacement, and going through those differences is another discussion in itself, but certainly a total knee replacement can definitely permanently solve the issue of knee pain.
अच्छा, तो ऐसा करते हैं डॉक्टर सागू, let us digress from the format I had initially proposed, half an hour. We'll just keep making it a mixture of spine versus joint, whatever comes in. You had mentioned something like a partial knee replacement versus a total knee replacement. Can you tell us what are these two options, and when can they be used, and who will benefit from a partial knee, who will benefit from a total knee, and also a very common question, whether both knees hurt, shall they be operated together at the same time, or shall we operate on them separately, and why?
Dr. C, yes. So, Dr. Sagu, before we proceed, to the answer by Dr. Sagu, I would like to ask the caller. So, madam, has your question been answered? आपको आपका जवाब मिल गया?
Yeah, thank you so much. I really appreciate it.
Thank you very much. But do stay tuned in because Dr. Sagu will give more information. So I will drop the call right now, but you can be tuned in and have more details about this thing. Okay?
Thank you.
Thank you very much. Yes, Dr. Sagu.
Okay, so that's a great topic that Dr. C just mentioned. So a partial knee versus a total knee. Basically, there are 3 compartments or 3 spaces in the knee joint. And the most common compartment or space in the knee that's commonly involved is the inside portion of the knee. So if you're early enough and you only have arthritis in that portion of the knee and the other 2 portions of the knee cartilage is okay, then what you do is you actually replace 1/2 of the knee. However, if 2 of the 3 or if all 3 compartments are involved, then you're looking at a full knee replacement. However, when patients come see me, I try to look for if they're a candidate for a partial knee replacement, only because the patients do so well. The recovery is dramatically quicker compared to a total knee replacement. Of course, my total knee replacements do quite well. However, the partial knee replacements, I mean, those patients, they don't need much physical therapy. There's less blood loss. The hospital stay is a lot less. This can actually be done on an outpatient procedure, meaning that the patient can come in the morning and then they can actually leave the surgery center within 12 to 14 to up to 20 hours, and they can go home and they can have physical therapy at home. So however, if someone has rheumatoid arthritis, or if they have underlying systemic cartilage issues, then they would not be a candidate for that. But when a patient initially sees me, I try to see if they're a candidate for partial knee replacement, only because they do so much better.
तो इनके कहने का मतलब, डॉक्टर सगू के कहने का मतलब ये है कि जोड़ जो होते हैं, नी का, घुटने का जो जोड़ होता है, उसमें बेसिकली एक ऊपर की हड्डी आती है और एक उसे फीमर बोलते हैं. उसमें 2-3 कंपोनेंट होते हैं. सिर्फ हड्डी का एक टुकड़ा नहीं है, एक लाठी की तरह नहीं होती है, बल्कि उसके नीचे जाके ठुड्डा बन जाता है और 2 ठुड्डे होते हैं वहां पर. एक अंदर की तरफ का होता है, एक बाहर की तरफ का होता है. उसमें कहाँ घिसावट ज्यादा हो रही है, कहाँ दर्द ज्यादा हो रहा है, घुटने बाईं तरफ ज्यादा दर्द हो रहे हैं, एक ही घुटना, लेकिन वो अंदर की तरफ ज्यादा दर्द दे रहा है, बाहर की तरफ ज्यादा दर्द दे रहा है, उसके हिसाब से ये अपना ट्रीटमेंट चेंज करते हैं. इसी प्रकार से नीचे घुटने का जो नीचे हिस्सा होता है, उसे टिबिया बोलते हैं. एक बड़ी सी हड्डी होती है जिसका बड़ा सा ठुड्डा ऊपर से होता है. ये दोनों हड्डियां एक दूसरे से जुड़ती हैं और इनके ऊपर कार्टिलेज लगी होती है, रबड़ की तरह वो होता है. तो आप ये समझिए 2 स्ट्रांग पीसेज आ गए और उसके बीच में रबड़ की वो हो गई, और फ्लूइड होता है उसके अंदर जो कि लुब्रिकेटिंग, एक तरीके का गियर ऑयल समझ लीजिए. तो ये सारी चीजें, और एक पटेला होता है, नी कैप, जिसे आप घुटने के ऊपर एक छोटी सी हड्डी गोल सी होती है, उसे आप छू के देख भी सकते हैं. जब आप घुटना मोड़ते हैं तो मुड़ती है, वो बाकी हिलती है वो वाली हड्डी. तो ये सारी चीजों के बीच में सब का सब सामान्य रूप से एकदम से खराब हो जाना ठीक नहीं है, होता नहीं है अक्सर. सो इट इज नॉट ऑलवेज दैट द एंटायर नी जॉइंट गोज बैड. सो व्हाट हैपेंस इज वी कैन replace part of it versus the entire knee joint. So people who have waited for a very long time, they are not the people who may be candidates for partial. So अगर आप बहुत देर तक इंतजार करें, कई सालों से आपके घुटने में दर्द है, तो शायद आपको कंप्लीट नी रिप्लेसमेंट की, अगर आपने ज्यादा इंतजार कर लिया और बहुत दर्द सह लिया कई सालों तक, तो आपको शायद पूरा टोटल नी TKR करना हो, टोटल नी रिप्लेसमेंट. लेकिन अगर आपका दर्द शुरू ही हुआ है, तो ये कह रहे हैं कि पार्शियल नी, यानी कि एक छोटा सा वन पार्ट ऑफ द नी कैन बी रिप्लेस्ड इन डिफरेंट और रिपेयर्ड, and that partial operation does not require long hospitalization. That can be done only in a matter of 10, 14, 20 hours, and then you go back home the same day, and then you can be rehabilitated. यानी कि आपका कोई आके वर्जिश कराएगा, आपको कुछ एक्सरसाइजेस कराएगा और आपका धीरे धीरे नी बहुत जल्दी ठीक हो जाएगा, ये कहना चाहते हैं. टोटल नी रिप्लेसमेंट ऑन द अदर साइड इज अ मोर डिटेल्ड ऑपरेशन. इन्हीं के बारे में मैं बोल रहा था 2 हफ्ते पहले. मेरे कोई रिलेटिव हैं, उन्होंने डॉक्टर सागू ने किया था. And once again, I want to give a disclaimer, neither Dr. Gidvani nor Dr. Sagu is affiliated with my practice, or I have any arrangement or any association with them outside of a completely collegial professional relationship, and I've just met them a couple of months back each. So, after giving that disclaimer, मैं ये बताऊंगा कि इन्होंने जो प्रोसीजर किया था मेरे रिलेटिव पे, वो टोटल नी रिप्लेसमेंट था और बोथ साइडेड था. तो डॉक्टर सागू फिर से बताइए कि कब आप वन नी का रिप्लेसमेंट करते हैं और कब आप दोनों के दोनों इकट्ठे करते हैं, एंड व्हाई डू यू प्रेफर वन ओवर द अदर टेक्निक?
That's a good question. So generally I prefer doing one total knee replacement instead of doing both at the same time. It does depend on the patient in terms of health, as well as if they're prepared to have or sustain 2 big knee operations at the same time. There's a lot of physical therapy or extra physical therapy that's needed to undergo both knee operations at the same time. But I prefer doing one total knee, doing the physical therapy, getting a good result, waiting at least 6 to 8 weeks, and then doing the opposite side. However, studies have shown that there's not a huge difference in terms of complication rates. The rates are very minimal. there's no increased complication rates if you properly do the surgery in a timely fashion, 1 versus 2. But, it also depends on the patient. If they're a strong-minded individual, certainly then I'm willing to do it. However, I still try to convince the patient to do one side and then the other side at a later time after full rehabilitation on the knee.
Okay, that's great. Ira, meanwhile, do we have any more callers?
Yes, Dr. C, we do have another caller who's been holding here for some time. Hello, you're on air with Dr. C, Dr. Sagu, and Dr. Sandeep Gidvani.
Hello, my name is Ritu. I'm calling from Cupertino. My question is with regard to lower back ache. Usually, ladies, because of pregnancy or whatever, develop lower back ache. And now I am over 50 years old, and that pain has caught up with me, and my lower back hurts a lot. Is that connected in any way to my flat feet and pronation or my knees, or how can I solve this lower backache problem?
Okay, this is a pretty loaded question. I will forward it to Dr. Gidvani after. Just asking a couple of quick questions. आपने pregnancy का mention किया, तो आपकी pregnancy आखिरी कब हुई थी?
The thing is that I think कि क्या होता है कि जो stomach के muscles होते हैं वो weak हो जाते हैं, and this is my own conjecture that maybe a lot other ladies suffer from lower backache because of this problem, and people say you must strengthen your stomach muscles, that will help your lower backache problem. I'm thinking, is it connected to that, connected to my flat feet and bunions, or what is it connected with?
And how can I solve this? एक तरीके से आप ये समझना चाहती हैं कि is it related to your flat feet or a pregnancy which you have not told me when was the last time you were pregnant, or it's just anecdotal opinion that you're saying that pregnant women tend to have low back pain, but then and the third thing is about your bunions and your concern.
Sorry, I was pregnant 20 years ago. So
20 years ago. So clearly, and did you have back pain all these 20 years?
Off and on, yes. My backache started with pregnancy. I had severe backache, but then after that, I didn't have it, and now it has reoccurred.
So, yani ki there is a finite amount of prolonged period of time when you did not have any backache. That means it may be causative, but chances are very poor that because of your pregnancy, which happened 20 years ago, you now experience back pain. So Dr. Gidvani will tell us a little more about the spinal structure, the weight-bearing issues, the flat feet, the bunions, the other associated conditions, and the causes of back pain around the age of 50. Dr. Gidvani, please.
Sure, yes. So thank you so much for your question. So actually you're spot on in a lot of the ways that you're thinking about your problem. We know from studying, spine and orthopedics and sort of the biomechanics of the body that certainly the way you stand and the way loads are transmitted from your feet upwards to your spine are definitely impacted by the foundation of how you stand, which are your feet. So you mentioned a term which is pronation, which is consistent with flat feet. It means that the arch of your foot is closer to the ground. As a result of that, sometimes the majority of the load will then be transmitted through the inside or medial compartment of your knee, and then upwards towards your spine. Also what we know, or your hips and then your spine. What we also know about loading, or when you walk around, run, or do any kind of impact activities, is that the base of the spine, or the lumbar spine, is where the greatest amount of load is absorbed. You can sort of understand that by saying that you have an entire spine structure. There's the cervical spine, the neck, the thoracic spine, or the mid sort of portion of your spine, the thoracic rib cage, and then the lumbar spine. And the lumbar spine really serves as the base of your spine where a lot of the load is transmitted through. And it's the reason why people, when they often come to us and say we have low back pain, one of the more common areas to develop problems is the bottom of the spine, or the L5-S1 disc space, because all the other load of the body is above that level. And again, you're spot on in terms of pregnancy. So yes, your core muscles, including your abdominals and your paraspinal extensor muscles, play a huge role in providing what's called build core strength or support to your spine. It's often the reason why we send patients to physical therapy to get their core stronger and therefore stabilize and help support their spinous structure. Remember those discs I talked about, as we load them and they degenerate, you then need the core muscles to step in and take a role and help support the spine when you're doing basic things like walking, going upstairs, downstairs, running, lifting, or anything like that. Certainly looking at an MRI of your lumbar spine where we look at the status of the discs, see how well hydrated they are, and see if there's any bulging components to them, will help us gain an appreciation for the health of your spine. And physical therapy would not be out of the realm of possibilities of things that you could start with to begin helping your back pain. But, of course, a thorough investigation, including an exam, as well as a possible MRI study or an X-ray, might help us gain a better perspective into where your back pain is coming from.
Okay, thank you so much.
Sure.
Thank you very much for calling.
जी आपको कोई भी आशंका है कुछ? Are you clear on the answers that you got, or do you have any follow-up questions?
My only follow-up question would be that if you take care of how your feet and are affecting, then do you need to wear an orthotic? Is that essential?
Yes, so certainly when you have flat feet, you can use an orthotic in your shoe that you can get over the counter. There are also prescribed versions of those orthotics that can help create your arch and the dynamics of the way that your foot stands. Often it's called a medial foot support to raise your arch. You might start with that and see if it helps, but certainly doing physical therapy to strengthen your core can be something you do in conjunction with that.
Okay, thank you very much.
Sure.
तो बाकी के श्रोताओं को बताना चाहूंगा कि जो अभी डॉक्टर गिदवानी ने बताया वो एक तरीके से साधारण लैंग्वेज में मैं ये बोलूंगा कि एक जो जेल पैड्स मिलते हैं कई बार आपको ड्रग स्टोर्स में या कई बार मेरे ख्याल से वॉलमार्ट, टारगेट ऐसी जगहों पे भी मिलते होंगे, लेकिन वॉलग्रीन्स हो गया, CVS हो गया, ऐसी जगहों पे भी मिलते हैं। मेरे ख्याल से सेफे पे भी होते हैं। डॉक्टर शोल्स इज वन नेम विच यू कैन ऑफन सी ऑन द स्टैंड्स. These are over the counter. You can put them under your feet, just on the inside, the insole of your shoes. This is more of a podiatry kind of a question, but these will at least give some more help to the weight-bearing areas of your feet, and it especially helps जिनका flat foot होता है. Flat foot यानी कि जब आप गीले से निकल के अगर आप सूखे जगह पे आप चलें तो आपके पाँव के जो निशान पड़ते हैं या आप सैंड पे चलते हैं जो पाँव के निशान होते हैं वो टिपिकली एक फुटप्रिंट होता है. अगर वो चौड़ा होने लग जाता है खास करके बीच की तरफ, जो कि एक पतला होके फिर से वापस एड़ी आती है, वैसा होना चाहिए क्योंकि पैर के अंदर कुछ आर्चेज होते हैं, लेकिन वो आर्चेज थोड़े से बैठने लग जाते हैं या फैट ज्यादा आने लग जाता है, घिसाई हो जाती है, वजन ज्यादा होता है, तो फ्लैट फुट जो होता है उससे काफी तकलीफ होती है लोगों को. एंड दैट फ्लैट फुट कैन कॉज अ लॉट ऑफ प्रॉब्लम्स. एक चीज तो मैं बोलूंगा कि अगर आपको जरूरत ना हो हाई हील्स पहनने की तो आप हाई हील्स ना पहने, जूते चौड़े पहने, कंफर्टेबल पहने. जो आपका पैर बोलता है उसके बारे में ज्यादा सुने, जो फैशन बोलता है उसके बारे में थोड़ा कम सुने जहां तक हो सके. अगर आप निकाल सकें उन जूतों को तो उससे ऐसा होता है कि आपका जो रीढ़ की हड्डी एकदम सीधी होनी चाहिए और नीचे उसका ट्रांसमिशन सीधा पैरों पे जाना चाहिए. और एक पर्टिकुलर कुदरत ने, नेचर ने हमारे को बनाया है जिस तरीके से वेट बेयर करने के लिए, अगर वो चेंज होने लग जाता है तो फिर आप उसमें फैशन के साथ जाके उसके साथ खिलवाड़ ना करें, वरना आपको दर्द होगा. अगर आप दर्द सहना चाहते हैं तो बहुत अच्छे, और उसके बाद सर्जरी कराना चाहते हैं तो हमारे पास बहुत अच्छे वर्ल्ड क्लास डॉक्टर्स हैं यहाँ पर स्टूडियो में, वो आपकी मदद करेंगे. किंतु आप अपने आप को तकलीफ ना दें क्योंकि आपको जिंदगी का पूरा प्रॉफिट उठाना है. Ira, or quick callers?
Yes, Dr. C, we do have another caller, and let's see what they have to say. Hello, you're on air.
Hi, this is Sunita. Actually, my father wants to talk to you regarding his knee pain and stuff like that.
Hanji, please.
Okay, sir.
Hi, this is Dr. Kabu. I have a knee problem, and my wife has backache problem. So first I would like to know where is the group of doctors, experts, what location can I have access? My insurance is Medicare and Medicare. I cannot.
मैं इन दोनों को बोलूंगा, ये अपने अपने हमारे दोनों डॉक्टर बताएंगे, लेकिन ये तो सच में जॉइंट फैमिली हो गई। एक नी डॉक्टर है, एक हमारे रीढ़ की हड्डी के डॉक्टर है, और दोनों आपके पास मरीज भी हैं। ये हमारी फैमिली मुझे काफी पसंद आती जा रही है। लेकिन डॉक्टर साधु, कैन यू प्लीज टेल अस about your practice, where you located, how you can be contacted, and then after that, Dr. Gidvani, please go ahead.
Can I know, I will give you my phone number. Can I know the location where, can I seek my appointments with them?
Absolutely, you can. Dr. Sagu, please go ahead and tell us your availability, your location, and your contact information.
Sure. So my office...
Location is Auckland? No. Okay.
Doctors बताएंगे, आप प्लीज कृपया अभी होल्ड करिए.
Yeah, I'd be more than happy to provide you information. So the title of my clinic is the Arthritis and Orthopedic Medical Clinic. It's in Los Gatos, right by Good Samaritan Hospital, so it's 14651 South Bascom Avenue, Suite 280 in Los Gatos. Area code is 95032. Yeah, so
he has a pain in his, the knees, and he is not able to walk. And is there any kind of a gel or any kind of...
Please hold, Madam, please hold. We will ask you to speak again, but right now the doctor is telling where he is practicing, because this call is not just for you, it's for everybody, this information. Dr. Sadhu, you practice once again in orthopedic and what specialist in Campbell, right? I thought it was Campbell.
Campbell is too far from us. Like, we are in Auckland, and I don't know how to reach and how to, I don't know.
That's great, but we are talking about the doctors. This thing, आपके बारे में अगर आप वहाँ तक जा सकते हैं, बहुत अच्छी बात है. नहीं जा सकते हैं, तो you'll have to find somebody local. I'm not promoting them. I'm just.
But is there any way you can give the phone number of the Dr. Sadhu, whatever?
We are giving all of that, madam. We'll have to either ask you to keep quiet for a little while, let them finish, and then please don't cross-talk. Otherwise, I will not be able to hold my radio show. So we will get back to you, and the doctors speak. Please don't cross-talk when they're talking. Dr. Sagu, please go ahead once again.
Thanks, Dr. C.
Interrupted a couple of times.
Yeah, so my office number is 408-356-0444. I am currently in the process to set up office here in Fremont. Currently in the process in the early phase of that, but my main office is again in Los Gatos, South San Jose. And once again, the phone number is 408-356-0444, and I'll have Dr. Gidvani provide his information.
Hi, so this is Dr. Gidvani. My practice is located in Campbell. The name of the practice is Silicon Valley Spine Institute. Our address is 221 East Hacienda Avenue, Suite A, Campbell, California, 95008. Our phone number is 408-376-3300. We also have a location in Fremont at 4535 Matos Drive. You can call the same main number to be seen at either of these locations. And again, the number is 408-376-3300. My specialty is spine surgery within any region of the spine, cervical, thoracic, or lumbar, and also the sacroiliac joints.
And also, if you do if the listeners, if you do a quick Google search on Dr. Sandeep Gidvani with a V, not a W, if you do a quick Google search on Dr. Sandeep Gidvani or Dr. Daljit Sagu, you will find information about them on Google. So, likh nahi paaye, if you were not able to write it down or note it down, it's okay, sure. You'll just find everything right there. Just one Google search and you have the information on the right hand side of the page about both the doctors.
मीरा, you're the Google queen. तुम्हें तो हर चीज Google चाहिए.
बिल्कुल, मैं खाना बनाना वैसे ही सीखी हूँ.
कभी Google पे ना जा सके, इसलिए मैं धीरे रूप से इन्हें बताना. I also want to tell all my listeners, I'm not promoting them. I'm just saying that I have used them and I found their services well. I've known them only for a brief period of time. Please go ahead and have your experiences with them directly. They are here as experts. They've been trained well, and I've gone through their CVs and bios, and they seem to have a very nice demeanor and a very nice training background. So if you would like to use them, please go ahead, and that's a choice between the two of you. It's not something that I'm promoting. I did want to tell them, मैं भी Fremont की तरफ रहता हूँ, and then if I have to travel all the way down to Los Gatos area to meet the best people, I will. So my recommendation to the caller, and I apologize if you felt that I was cutting you off, but you cannot interrupt when our doctors are speaking, please. And at that time, I just said, what is the better choice for me? Do I want to go to the person that I want, like, trust, or and know more about, or who's good at doing what I have found out they are good at doing, or and for that, if I have to travel about 15-20 minutes extra, that's absolutely fine. But that's my opinion. I would trade convenience over expertise. But some people cannot do that, or will not do that, or their transportation is the issue, or continued going up and down becomes a problem. Then you do have many, many people available around your areas. All you have to do is, Google is there to help you out. You can have directories from your insurance providers. There's hearsay, you can take references, और अगर आपको कभी भी तकलीफ हो कोई विशेषज्ञ यानी कि स्पेशलिस्ट ढूंढने में, please don't hesitate to contact us. If I don't know the answer, I'll try to find out the answer for you and give it to you on air, so that आपकी समस्या ही नहीं, मेरे कई श्रोताओं की समस्या ऐसी है, सबकी समस्याओं का समाधान हो जाएगा. Everybody will get to know what kind of doctors are available, or what are the resources available to reach them. क्योंकि ये सिर्फ आपकी common problem नहीं, कई लोगों की problem है.
Absolutely. So knee pains and backaches, a lot of people are facing these problems mainly because of the lifestyle that we lead these days, right?
Correct, that's right. और ये बढ़ता जा रहा है, और छोटी उम्र में भी आना शुरू हो गया काफी, मतलब जल्दी होना शुरू हो गया. पहले बुढ़ापे में या सीनियर्स के उसमें होता था. आजकल जवान लोगों को 20 साल 18 साल के लोगों को भी बैक एक होना शुरू हो गया. तो उसके बारे में भी हम बात करेंगे, लेकिन आई थिंक Ira, let's take another call. We can try to take as many people as we can before the show is over.
Sure, Dr. C. So let's move on to the caller. Hello, you are on air.
Hi, my name is Meenakshi, and I have a very bad arthritis in my knee. You have some kind of a medicine to get rid of the pain or something? And I have a flesh
foot too. Meenakshi ji, आप कहाँ से बोल रही हैं?
Fremont से.
अपनी उम्र भी बताएं, please.
64.
64.
So you're 64?
मीनाक्षी जी, आपकी आवाज बहुत ही एकदम, मतलब मैं कहता हूँ कि 35 से ज्यादा नहीं लगती है. तो बधाई उस चीज के लिए. And I will direct this conversation to Dr. Sagu for arthritis, and please go ahead and conduct the rest of the conversation, Dr. Sagu.
Yeah, absolutely. So, anytime I have a patient coming in with knee pain, and they have pain when they're walking, pain with, any activity, the first thing I'm going to do is I'm going to get x-rays, because I want to see, what grade of arthritis do you have, and where exactly is the arthritis coming from. And, again, if you have minimal arthritis, and there are other structures in the knee that can also be affected. It's not just purely cartilage. It can be the meniscus. Basically, that's a spongy cartilage that actually helps to absorb some of the weight, and sometimes that can be torn. You have major ligaments in the knee that can potentially be torn as well. But the first step is to get x-rays. And then say, we get x-rays and you have mild to moderate grade arthritis, then we'd first start off, with physical therapy. We can, do, swimming exercises. I'm not a huge fan of, taking oral pain medications. I think that's a disadvantage to the patient population. There's a number of family practice doctors who actually do prescribe those, and I'm totally against that, because it only masks the pain. It has side effects. You can get dependent on those pain medications. So everything I do is based on minimizing the pain, however, avoiding oral pain medication. So we have things like, again, physical therapy. We have different types of injections that we can utilize to help reduce the pain. Whatever we do, we want to try to, improve the quality of life and improve your activity level. However, if we, spend a year and a half, or 2 years on, trying to resolve these issues, we might come to a point where, we might have to do surgery. However, it's a long process, and it's a process that, we embark on together.
यानी कि मधु जी, अगर आपको अंग्रेजी में अगर आप कच्ची अगर हैं तो अभी बता दीजिए, ताकि मैं फिर इसका विश्लेषण हिंदी में भी विस्तार पूर्वक.
नहीं, वैसे तो मैं ड्राइविंग बहुत करती हूँ. 300 माइल हर रोज मेरा ड्राइविंग होता है काम के लिए. तो इसलिए मैं पूछ रही थी कि कोई रेमेडीज हो, पेन दूर करने के लिए, तो कोई पिल्स वगैरह में ले
दिनचर्या अपनी चलाने के लिए आपको कोई ऐसी समस्या का समाधान चाहिए कि आपको ये जो आर्थराइटिस यानी कि जोड़ों का दर्द है ये थोड़ा कम रहे, ताकि आप उसे टॉलरेट कर सकें और अपना दिनचर्या चला सकें, अपना काम कर सकें, अपनी एक्टिविटीज ऑफ डेली लिविंग को अच्छे से रख सकें. इज दैट व्हाट यू लुकिंग फॉर?
हाँ, जस्ट पेन दूर करने के लिए, मेरी जॉब है.
और एक चीज आप बताएं मुझे कि कितने जोड़ों में आपको दर्द है?
जी,
कितने जोड़ों में? सिर्फ दोनों घुटनों में है या कहाँ कौन से जोड़ों में?
सिर्फ घुटनों में ही है, राइट लेग में.
और तो कहीं अब राइट और लेफ्ट दोनों में. तो आप ऐसा करें, मेरे ख्याल से तो आप कभी जाके इनसे नहीं तो किसी और विशेषज्ञ से जो जोड़ों का काम करते हैं और खास करके घुटनों की तरफ उनका फोकस है, उनसे जरूर जाके मिलिए. अगर आप डॉक्टर सागू से मिलना चाहते हैं तो मेरी तरफ से तो मैंने अभी बताया, मैंने अपने रिलेटिव्स उन्होंने किया, वो तो अब ऑलमोस्ट थोड़ा रुक के, लेकिन दोनों नीज उन्होंने कराए थे, जो चैलेंजिंग ऑपरेशन है उन्होंने किया, एंड शी इज डूइंग वेरी वेल. So she's 70 years old, so she's doing fantastic. I think good surgeons sampling is already available, and I can vouch for that. अगर आप इनसे मिलना चाहें और अपना ट्रीटमेंट ऑप्शंस पता करना चाहें, whether it is physiotherapy or it is medicines or it is injections or it is partial knee
इंजेक्शन मैंने लिया है 2 बार.
हाँ जी, मैं फिर से एक बार.
वो बोल रही है वो 2 बार इंजेक्शन ले चुकी हैं.
2 बार ले चुकी हैं, तो ये मेरे ख्याल से 5 बार लिए जा सकते हैं. बाकी डॉक्टर साधु ज्यादा बताएंगे. इंजेक्शन भी अलग अलग किस्म के होते हैं जहाँ तक मेरा समझ. तो कोई जेल वाले इंजेक्शन, कोई लॉन्ग
कॉर्टिसोन का इंजेक्शन होता है ना, कॉर्टिसोन का इंजेक्शन देते हैं ना.
भी अलग अलग किस्म के आजकल आने आ गए. वो काफी मतलब वो कॉर्टिसोन जो हम बोलते हैं वो बड़ा एक तरीके से कहना कि मैंने खाना खा लिया, लेकिन अब ये नहीं बताना कि मैंने रोटी खाई है या चावल खाया है या कौन सा खाया है. खाना एक जनरल चीज हो जाती है. वैसे कॉर्टिसोन का इंजेक्शन भी एक जनरल सी हो जाती है. उसके साथ क्या मिश्रित है, वो किस टाइप का है, लॉन्ग एक्टिंग है, शॉर्ट एक्टिंग है, किस कंपनी ने बनाया है, क्या डिजाइन है उसका कि वो कितने देर तक लास्ट करे. तो एक्चुअली दिट्स अ गुड क्वेश्चन. डॉक्टर साहू, कैन यू टेल अस मोर अबाउट दीज इंजेक्शंस? दे आर वेरी पॉपुलर, वेरी कॉमन. व्हेन आर दे गिवन? How many times? What are the different types available? What are the costs? What is covered by insurance, etc., etc.?
Yeah, so there's 2 overall general types of injections. One's the steroid injection or the cortisone shot. The second is the jelly injection, or what we call a viscosupplementation. So the cortisone shot, and a lot of people have myths about this, or the general public, where they're afraid of getting a cortisone shot because they're afraid of the side effects. But what most people don't know is that the cortisone, whether it's in the back or the knee or the hip, it's localized. It just stays within that joint region. It doesn't go throughout the body, and you don't get those complications or side effects that people take with oral steroids. So when someone approaches me and we start doing cortisone shots, we only limit 3 within a 12-month calendar period. If you do too much, that actually can be hurting the cartilage as well. So you want to space it out 3, max 4 within 12 months. However, besides doing the cortisone shots, you can do the jelly injections, and so the jelly injections actually help to coat and lubricate the knee joint. And it's a series of 3 injections. Sometimes there are some physicians who do 5 injections, but it's 3 injections, 1 week in a row. So 3 weeks in a row, you get 1 injection. Most people don't feel a difference after the first injection, but they usually feel a difference after the second and or the third injection. And then that you can do, every 6 months or so. But one thing to know is that the most beneficial injection is going to be the first one, and then say it helps for 6 months, and then you want another injection. It probably won't last as long as the first injection, just because the body gets a little bit more tolerant to it. So those are basically the 2 major types. And in terms of insurances, we usually check with the insurance to see if they cover it. Of course, Medicare will cover it, and most insurances do.
Okay. One more question.
One other follow-up on that is, सॉरी मैं इनसे एक और सवाल पूछूंगा. डॉक्टर साहब ये बताइए कि इफ द 3 इंजेक्शंस आर गिवन इन दैट 12-month पीरियड, यानी कि 1 साल में 3 दिए जा सकते हैं पर घुटना, तो वो तीनों इकट्ठे दिए जाने चाहिए या मरीज को क्या सोचना चाहिए? उन्हें ये सोचना चाहिए पहला लिया, आपने कहा कि पहले वाले में सबसे ज्यादा इफेक्ट आता है, फिर पहला लिया और मैं खुश हूं अगले पहले 1-2-3 हफ्ते 1-2-3 महीने, तो क्या मुझे दूसरा उसी समय आप ही के सजेस्टेड टाइमिंग पे लेना चाहिए? जैसे एंटीबायोटिक्स कहते हैं कि अगर आपकी खांसी ठीक हो गई या जुकाम ठीक हो गया, जो भी ठीक हो गया है, लेकिन फिर भी अगर 7 दिन का है तो पूरा कोर्स खत्म करना चाहिए. तो आपकी तरह वो 3 हर हफ्ते का एक कोर्स होता है वो लेना चाहिए, या पहले के बाद अगर आराम आ गया है तो रुक जाए उस समय एंड देन टेक द नेक्स्ट वन व्हेन द पेन रीअपियर्स? इन दोनों में से कौन सी स्ट्रैटेजी करनी चाहिए बताएं.
अच्छा डॉक्टर साहब, मैंने सुना है कि ये इंजेक्शन लेते हैं उसमें बोन्स की इफेक्ट होती है, सही बात है?
ओके, सो आपका ये सवाल भी मैं करूंगा, लेकिन डॉक्टर साहब पहले प्लीज कैन यू आंसर द क्वेश्चन आई हैड. इफ यू वांट आई कैन एक्सप्लेन इन इंग्लिश. शुड पीपल गो इन 3 injection sequences, one after another, or if they have significant improvement after the first one, should they just take a break and when the pain reappears, then go for this number 2 injection in that 12-month prescribed period? Which one should be done?
Yeah, so, when a patient comes to me, the first thing I do is I do a cortisone shot because that can, help up to 6 months or even a year. However, what I tell patients is that there's no way you can predict, how long it's going to help. For some patients, it helps for 2 weeks, 1 week. There's some patients that, all the pain goes away for a full year. So there's no way that you can predict that. And then in terms of the jelly injection, I do strongly recommend to complete the course. Even if you feel a difference after the first or second, I would recommend doing the full course, which is the 3 injections.
The 3 injection one at a time. So that is one. And हमारे caller का her question is also by taking these cortisone shots, it is and she's not the only one. I've heard it from other people also. It is bad for the knee. That's the common myth, and you had given that answer. But can you explain it once again? Why would it be bad for the knee if we got too many of them? And what is the reasoning behind? Why does it destroy the cartilage?
So basically, it's a strong anti-inflammatory. So basically, it stops the production of healing cells. So if you have too much healing going on, basically that's a lot of arthritis or a lot of inflammation, and so a lot of inflammation causes a lot of pain. However, if you do too much, that can actually affect the quality of your cartilage, the quality of your ligaments. Your ligaments get a little bit weaker, and then because your ligaments get weaker, the knee gets weaker and it starts to shift a little bit more, and that's what causes an unstable knee, which then increases your pain. Same thing with the cartilage. So it actually, too much of an anti-inflammatory is not very beneficial, obviously, for the knee or any joint for that matter.
Okay, excellent. And the same applies to the spine also. They have epidurals available. Another thing, Dr. Gidvani, can you quickly tell us? We have very few minutes left. So what are the injections available for the spine and how do they help and to whom do they help?
So there are a variety of different injections that you can use depending on where a spine surgeon might think your pain is coming from. Typical scenarios where you have a disc bulge or a pinched nerve or even a slipped disc and the nerve is being pinched off, then you qualify for what's called a transforaminal injection, and you're injecting into the foramen or hole where the nerve root exits. It's usually a combination of local anesthetic and steroid. And again, just like in the knee, like Dr. Sagu mentioned, you want to limit the amount of times you do that injection because the steroid, in the case of the spine, can actually deposit out and cause a compressive effect on the nerve, which is already being pressed upon by the disc. Other injections include intra-articular facet injections, oftentimes done when somebody suspects that this is a mechanical source of pain or that the instability that's there in terms of the motion at one level is occurring through the back joint or the facet joint. You can inject this this joint to see if that creates relief for the patient in terms of mechanical back pain. And then also there are things like a sacroiliac joint injection. So if you're working somebody up to see if their root cause of the back pain is the sacroiliac joint, then you can inject that joint itself and see if somebody gets temporary relief. So in this way, these injections serve both diagnostic purposes in that they can help identify the source of the pain, as well as potentially therapeutic, as you can get anywhere from 1 week to 6 weeks to up to 6 months, 3 to 6 months of relief from any of these injections.
Well, that is very nice. So 1 week to 6 months. So that can be almost, यानी कि 1 हफ्ते से लेकर 6 महीने तक आपको इसका आराम मिल सकता है अगर आपको बैक पेन है ऐसे इंजेक्शंस लगवाने से, जिसमें हमें काफी वैज्ञानिक और साइंटिफिक और बायोटेक्निकल हमें इंफॉर्मेशन दी है, फैसेट जॉइंट और ये जॉइंट और वो जॉइंट, लेकिन कहने का मतलब रीढ़ की हड्डी के अंदर इंजेक्शन लग सकते हैं जिसके कारण आपको अपने दर्द से आराम मिल सकता है और उसमें फिर आपको गोलियां खाने की जरूरत नहीं है, सर्जरी कराने की जरूरत नहीं है। आप अपनी दिनचर्या बड़े आराम से चला सकते हैं, गाड़ियां चला सकते हैं, झुक के चीजें उठा सकते हैं, सारी चीजें कर सकते हैं। और अब मैं आपको ये भी बताना चाहता हूँ, विज्ञात करना चाहता हूँ कि सिलिकॉन वैली मेडिकल इमेजिंग में ये वाले इंजेक्शंस फ्लोरोस्कोपिक गाइडेंस सीटीज गाइडेड इंजेक्शन स्टार्ट हो गए हैं, क्योंकि हमारे पास एक बहुत ही बढ़िया विशेषज्ञ आई हैं, उनका नाम है डॉक्टर ममता मैनेनी। 2 हफ्ते पहले मैं उन्हें भी शो पे लेकर आया था 5 मिनट के लिए। So she's available. She's very good at doing all these kind of injections. And if any of your doctors would like to prescribe, I would recommend that she can do very fine spinal injections whenever it is indicated. So with all of this, I would like to thank both our guests, and I hope I have been able to answer many more joints. This is a very large issue about joints and spine and everything. I would encourage you to write an email to IRA at radiozindagi.com and tell me all about your problems about these, so that if we still have to do another segment, we can do another segment. But meanwhile, please reduce weight, because your strain on your joints and your back will also reduce with this. Thank you so much for tuning in. I really appreciate your help, support, your wonderful feedback. Thank you both doctors, Dr. Gidvani, Dr. Sagu. इन दोनों को अगर आप मिलना चाहते हैं तो प्लीज गूगल इट एंड फाइंड देयर लोकेशन देयर इन सैन जोसे, लॉस गैटोस, कैंपबेल एरिया. एंड आई अप्रिशिएट योर प्रेजेंस इन द स्टूडियो टुडे. सारे के सारे श्रोताओं, thank you so much for tuning.
Thank you, Dr. C, for your long distance love. आप कहाँ बैठ के कहाँ पे फोन कर रहे हैं, and you know, but well,
मैं
yes.
फोन पे ये सब कुछ कर रहा था.
जी हाँ.
I had to get out of my seminar to get into this.
But absolutely, the listeners do appreciate. आप physically यहाँ पे नहीं हैं, but आपका दिल और दिमाग यहाँ पे है, and we definitely miss you, but we will see you next week.
Next week I'll be there.
Absolutely, and thank you so much for coming on air.
जिंदगी का पूरा प्रॉफिट उठाइए, अपनी जिंदगी को पूरा भरपूर जिंदगी जिए. Thank you so much.
Thank you, Dr. C. Thank you, Dr. Gidvani. Thank you, Dr. Sagu. And thank you, listeners, for tuning in. And सुनना ना भूलिए हेल्थ की बात डॉक्टर C के साथ every Wednesdays from 12 to 1. This is RJ signing off for now. जिए जाओ.